targeted therapy, unlike chemotherapy, tries to take advantage of the unique features of the individual's cancer. So targeted therapy is going after something that's in the cancer that creates a vulnerability to the targeted therapy. It's not a generalized process like chemotherapy, which affects generalized methods by which cells divide. And hence, in order to figure out who may benefit from targeted therapy, you need to test individuals' cancers to understand, are they potential candidates for targeted therapy. Lung cancers, specifically non-small cell lung cancers, have lots of different genomic subsets of the disease. The most common ones are ones that have an EGFR, or epidermal growth factor receptor mutation, or an ALK, or anaplastic lymphoma kinase rearrangement. These are subsets of lung cancers that occur in about 15% and 5% of non-small cell lung cancers, respectively. And if a doctor discovers that the tumor has one of these alterations, then we know from clinical trials and clinical experience that use of targeted therapies is actually much more effective and much better in terms of side effects than using chemotherapy, because those cancers are specifically dependent on these genomic mechanisms for their growth and survival, and hence when you find ways to target those, the strategies end up being much more effective clinically. Those are not the only examples. There are many other ones that are being tested at the current time and will continue to be so in the future. I think the most important thing for someone with newly diagnosed lung cancer is to perform genetic testing of their tumor to understand, is that cancer one that could potentially be treated with targeted therapy, or is it a cancer that needs to be treated with some other type of treatment modality.